Okay. So, good evening, everyone. Happy Eclipse Day. I'm Donald Gardner. I'm a member of Naipan Green, which is up near Albany, and I'm on the Naipan Single Payer Committee. And we're happy to see you. Well, those of you who showed your faces. Um, tonight is a pretty special night. We have an opportunity to hear from someone who really knows what's going on in the world of the New York Health Act, Betty Kolod, and we'll speak with her. She'll speak with us in a couple of minutes. Then we have an opportunity to break off into small groups and talk to ourselves, talk to each other about how we see the New York Health Act, what we understand the New York Health Act to be, so that when we speak to our colleagues, our family, our friends, or maybe if we can speak to in front of a group, we have an idea of what the highlights are of the act and what's important to us, what's important to our audience. But the main thing is to be able to spread the word because there are still far too many people who never heard of it, and there are even some doctors who haven't heard of it. And we need to make sure that these folks understand and become stakeholders. And as we were talking about earlier, we tell 10 people and they each tell 10 people and they tell 10 people and it spreads. And the last sentence in the conversation is, now please call your New York State senator and assembly member and tell them to pass the New York Health Act. Damn it, let's get this thing moving. So we are recording the session. Tonight will be about an hour or so, and I'm going to pass it along to Julie Wegner, who will then introduce Betty. Take
It
it,
is my
Julie.
absolute pleasure to introduce Betty. First of all, she is an awesome human being, and I am thrilled that she is our board chair of the New York Metro chapter of Physicians for National Health program. In addition to that, she is the chair of the state legislative advocacy working group that we have, which we affectionately call SLOG or SLOG or something like that. But basically, it's about the New York Health Act and organizing for it. And Betty is an assistant professor of internal medicine and preventive medicine. She's a primary care physician for people who use drugs. And she's an educator of virtually everybody, pre-med students, medical students, physicians, public health people, and all of us tonight. So thank you, Betty, for being with us, and you're on.
So much. It's my pleasure to be here with all of you, and I hope I don't have any glitches related to driving back from the Adirondacks to see the eclipse. So I tried to distill the way that I like to present the New York Health Act into, I started off with 2 slides. It's a few more than 2 slides at this point, but a lot of them are optional depending on how you, well, really the audience that you're speaking with and what else you've shared with that audience at the point that you bring up the New York Health Act. So I'm just going to share this little mini slide deck and talk you through how I like to present it. Okay, so I put in this really fantastic depiction of how a single payer system works as the first slide in this deck. I use a variety of different approaches to this. Often I'll have, more of a set of slides building a case for single payer, but I just love how this is, one slide explains how a single payer system works, that we collect taxes, they go to our government, and the government pays for our health care, and the hospitals and providers get reimbursed. So some way of explaining what a single payer system is and why we need a single payer system, why we see more efficiency under a single payer system is often a good place to start. Once you've explained that, transitioning into what is the New York Health Act. So I love this depiction. So the first one was from Dr. Danny Nagase at, I think he's at Brightpoint and Columbia. But this slide was made by Yu Ling, which many of you know from the campaign for, formerly of the Campaign for New York Health. And I love the way that this slide encapsulates everything that you need to know about the New York Health Act in one place. So when I'm explaining the New York Health Act, to somebody in, 60 seconds or less, I actually picture this slide in my head. So the three main points on the New York Health Act are, first of all, it covers every single New Yorker. So that's everybody who lives in New York State, everybody who is a full-time worker in New York State. And the third thing that I bring up is that it's regardless of immigration status. That's it. The next thing that you can bring up about the New York Health Act is that there's no cost at point of care. So that means no premiums, co-pays. We know that deductibles are a big barrier to people accessing care. So that's the second point, however deep you want to go into it. And then the third extremely important point is how comprehensive the care that we would receive under the New York Health Act would be. And so I usually mention some degree of detail about outpatient care, inpatient care, primary care, specialty care, but I always mention vision, dental, hearing, and long-term care. So those are the services that most of us are not getting under our current plans, and virtually no plan is covering for long-term care. And then when I mention long-term care, I usually say that's both inside of a facility, in setting nursing home, or in the outpatients, in the home setting, like home care services, so that people can age at home with dignity. Depending on the setting in which you're presenting, you might want to also bring up reproductive health care, LGBTQIA health care, other types of healthcare that are under attack in different settings, but definitely vision, dental, hearing, and long-term care. Another major point that I always bring up is the savings that we would see under the New York Health Act. So by this point, I've usually explained that if you look at traditional Medicare and compare it to insurance companies and Medicare Advantage plans, that there's inefficiency in how those plans are run. So by this point in the talk, people will be very familiar with the idea that if you implement a single payer plan like the New York Health Act, you'll save. So this is an independent analysis done by the RAND Corporation. Sorry if my toolbar is in the way. And it's projected that we would save $20 billion on no longer needing to haggle with insurance companies to get reimbursed for care. We would save another $16 billion as a state on not having to hire several levels of billers in the hospital and in doctors' offices to be reimbursed for care from for insurance companies. And then I usually don't get into this point if it's not a longer talk, but you can also talk about the fact that as a state, we would be negotiating for better prices on drugs and devices. And so this is projected to save almost $19 billion. So even with this greater spending on covering more New Yorkers and providing long-term care and other services we're not getting, and improving provider fees, so which may retain more of the providers we need, like primary care docs, we're still projected to see a net savings of about $11.4 billion under the New York Health Act. So those are really the 4 points that I always mention when I'm talking about the New York Health Act. Cover all New Yorkers, no cost at point of service, the most comprehensive plan in existence, and that we would save money. The last optional point that you can mention if you have, I guess, 2 other optional points, are how far along we are in the process of passing the New York Health Act. So I have 2 different depictions of that here. So when I presented to my department, I presented it this way, kind of educating people about how a bill becomes a law and highlighting that the New York Health Act has passed through the New York State Assembly multiple times, but has not yet been brought up for a vote in the Senate Health Committee. So that's why it's kind of between steps 3 and 4 here. Another way of depicting it is to show who are the people we're really working with to pass the bill. So the fact that it's passed through the Assembly 5 times, we can show Amy Paulin is our leader there, and that it has majority support also in the Senate. So sometimes I use that depiction. So this is an optional point that you can talk about to show that this isn't a pie in the sky goal. This is something that we could reasonably achieve. And then another, did I put it in the slide deck? I didn't even put it in the slide deck because I don't think if you're really doing a mini presentation, you don't need to include this. But the final point that you can consider making is how the progressive tax structure would work. So explaining that our current healthcare system is a regressive tax, pricing system where people who make less money spend more of their income on healthcare, and people who make more money spend a smaller proportion of their income on healthcare. Whereas under the New York Health Act, people would pay into the New York Health Plan based on their ability to pay, based on how much income they make. That's an optional point that you can talk about, that we would have increased justice under the New York Health Plan. So I could stop sharing, or if anyone has questions about these basic slides, I'm happy to take any questions. Did that feel approachable? Does anyone here envision themselves giving a talk about the New York Health Act more easily now? Gina, are you gonna say something?
No, but I do see myself speaking about it more easily. It's really good to think about it as, okay, the 4 key items, and then move into the second level of additional items. Thank you for that.
Of course,
Folks
thank you.
can put questions in the chat if you wish also. Otherwise, let's see your face and raise your hand. Well, I've got one, Betty. I'm interested in long-term care. My wife and I are in our late 70s. Actually, we're 79. And we have a long-term care plan that we've paid into for years. And I'd like to know what happens to the money that I've paid into my plan when the New York Health Act is passed and I get covered by the New York Health Act long-term care part.
Yeah, so, and I'm glad I have my team here. I see Steve and Mark, and I know Julie knows a lot about this stuff also. So yeah, my understanding is that the good news is that you would have guaranteed coverage for your long-term care, and you wouldn't have to worry about running out of money to cover your long-term care. Like, for example, my grandmother is 101. She has a long-term care plan that she's been paying into. And when the first time she was put into a nursing home, we were still paying $200 a day on top of what we were getting from her long-term care plan. So this would be added benefit on top of what you're already paying for. That would be my answer to that. Do others have alternate approaches to answering that question?
Okay, thank you.
There's a question in the chat.
So the
All
the question in the chat from Eugene, what about coverage if someone is out of state and needs care, emergency room or emergency surgery? So the New York Health Plan would be your insurance plan. So it would cover you when you're out of state if you encounter an emergency.
Steve has a question.
Oh, it's wonderful how these questions always come up amongst us, and yet I've never heard them come up in general when we talk about other insurers. One point, for example, on the out of state is, well, how do you think it works currently with your state-based, state-licensed insurance plan when you go out of state? And the answer is they have interstate compacts to cover these things. With the caveat that, of course, with narrow networks, as I found out with my wife recently, not that long ago, when she got care in South Dakota, I'm sorry, North Dakota, that you may wind up with bills later. But there are these, workarounds that the current system has that presumably the New York Health Act as the insurance company would have, also do. I got a little, I'm a little fuzzy tonight, sorry, if that made sense.
It did. It did.
There's
Thank you.
two hands raised.
Ryan McHugh.
Oh, I think Mary had her hand up.
Oh, all right.
Sorry.
Yeah, another out-of-state question. If you move out of state, do you lose New York State coverage?
Sorry, I should have put my headphones on. For some reason, you sound a little bit quiet. What was your out of state question?
Oh, if you move out of state, are you still covered?
Oh, yes. So if you move out of, I don't know why I'm feeling, I've been thinking about these really tough scenarios with retirees, and so I'm just a little, lost in the details right now. But yeah, so if you move out of state, but wait, correct me if I'm wrong, other PNHP people here, I think unless you're a public retiree from New York, you wouldn't take it with you out of state. Is that right? That would be the only situation where you would take it with you if you moved out of state?
You mean like the Empire Plan?
Like if you retired from any union that was a public sector union in New York.
Hmm.
So, this is where I don't want anyone here to get intimidated by the idea of getting really tough questions. This is part of advocacy that, you're always going to get very specific situation questions, and, I'll get back to you with the answer. But yeah, big picture, if you move out of state, it will not follow you out of state. If you travel out of state, it will be your plan, it'll cover you. But if you move out of state, no, it will not follow you.
So
It's
the
only
essence-
for residents.
You would
of
still
New
have your
York.
Medicare as a national, somebody for the US, if you move to Florida, like today, if you're in New York and you have some sort of, and you have Medicare, your Medicare is still eligible in Florida, right? If you have a retirement benefit plan that was through the public sector unions, then I guess what we're saying is that, again, one of those interstate compacts would apply. The New York Health Act would continue to cover you. But if you were in some other category, I guess the answer is no, it would not. So I guess that's a reason to stay in New York and not go to Florida, amongst many reasons.
Yeah, the essence there is it's declared a New York State resident plan. It presumes we live in New York State, right?
Yeah, I mean, if you move out of state, you would, and you have Medicare, you would still be able to buy a Medigap plan or switch into a Medicare Advantage
Right.
plan if one wanted as your supplemental.
Okay. All right. Thank you, Steve.
I think, I mean, we should double check on these, on the out-of-state one,
but
yeah. I mean, the
But
one
yeah,
that we
it's-
know the answer that's gotten cleaner is the, if you live in New York State but work out of state, are you covered? And the answer is yes. If you live in another state and work full-time in New York State, then you are covered, yes. Have to double check on what the hours are for full-time. It's not actually 40 hours a week. It may be 32. There's a weird definition of what full-time means legally.
But yeah, we're not talking in this presentation today. We're not talking about getting into these really tough details with people. It's more about spreading the word about the New York Health Act, getting people to know the name, the New York Health Act, and the basics that we talked about. Ryan?
Right. Ryan?
Yeah, I think just building off kind of that idea then is that I was going to ask, because I have been going from the Medicare for All stance where I like to say 30 million Americans have absolutely no health care at all, with millions more who have no insurance. So for that, like in New York specifically, what percentage of New Yorkers have absolutely no health care? And then what percentage of New Yorkers would you say are underinsured? And then I guess then even to build off that is that I have multiple sclerosis and I'm seizure prone, and I was diagnosed when I was 11. So I'm in kind of that, gap where I've never really been able to build up my career to have a good job or a good enough job to have a good healthcare program. So I'm really in that gap of, you know, I think that you were just kind of mentioning, beforehand, that maybe we'll get back to that later with more details. But yeah, because I think that's my selling point for my personal story, honestly. So I'm curious to know what that specific number is. So
Yeah, I don't usually mention those numbers particularly, so I don't have those numbers at my fingertips, but I think that's a great pitch. So trying to think of New York specific sources of data like that. I know Kaiser Family Foundation is a great source for data in general, and often you can sort by state. And the Community Service Society is another really good source for data. And they endorse the New York Health Act. They're big supporters of the New York Health Act. So we could request those specific numbers if you think that would be helpful for a New York Health Act pitch. And then I totally agree with you that exactly like you're saying, you're in a group of people who would really benefit from the New York Health Act, underinsured people who, if the deductible is too high, then you're not really covered. Yeah.
If I,
Thanks for sharing.
if I can just jump in, I mean, I think, I'm sorry to jump in, but I think the accepted figure is about 5% or 1 million New Yorkers without any insurance. And then the number of New Yorkers underinsured is much higher than that. And I can't put a number, I don't know if it's 40% or 50%, but it's a huge amount of people that are underinsured. And by that, I mean, you could think about anybody who is denied treatment or that they need, so how many people is that? You hear that all the time.
And I think just to build off that, that's like, I think that's how we can actually get people to come with us, because that's the cross-party alignment. Everyone goes through that experience of, just being underinsured, essentially. So I think, I mean, yeah, go on. But yeah, I think that's basically, for me anyway, our main selling point, to get people who are on the edge or don't really know what they're talking about, not to like no harm than anything, but like to really get that selling point of people who are like more skeptical.
Okay, thank you, Ryan.
Yeah,
Thank you.
absolutely. Depends on how you're defining underinsured, because if it's, in general, New York State has the best Medicaid. And when I see that a patient has Medicaid, I'm happy about that, because I know that most of their care is just going to be covered. But that means if they're going to go to a specialist, they're going to wait several months to see that specialist. I mean, that's under insurance. If they have a diagnosis of obesity or morbid obesity, the most effective medications for that are not on the formulary for Medicaid. So that's a form of underinsurance. So it could be exactly like you said, the majority of New Yorkers, depending on how you slice it.
Okay, thank you.
Thank you very much.
Elle has your hand up. I only can identify you as Elle.
Hello.
Hi.
Hi. My name's Tom. First of all, Betty, thank you so much for that presentation. The data was really clear and specific. I really appreciated that, and that's going to help us talk about this, right? I think I'd like to ask just about a pitch, or about when we get into persuasion, either a campaign or advocacy, or even if you're just talking to your friends and loved ones about this. We're going to encounter people on the other side, or people who are moderates, who might the human element doesn't really matter to them, and they might just say things like, but we're paying for people who aren't from here, or it's socialism, you know what I mean? Or some might even say this is communist, I mean, with persuasion, we want to bring people on our side here, and that's why this data is useful. So I guess my question is, when we're approaching some of these moderate folks or people on the right, and they are indeed here in New York, we just lost 4 congressional seats the last election. My instinct is the economic component, which is, hey, we're actually saving money and here's the data on it, would be my instinct in terms of persuasion or pitching. Would you say that's correct, or is there another avenue to go in terms of talking to folks like this and bringing them over?
Yeah, so I would agree with you. Two approaches that would come to mind for me would be the data savings approach, which you can really double down on. It's the independent analysis, the projection of how much we would save, which some people will come back and say, oh, that's outdated. I don't agree with that analysis. So then bringing in other types of savings that have been projected. So I know Steve always includes in his presentations the report from the Albany treasurer about how much money the District of Albany would save, how much the school districts would save, how much they would save on providing insurance for their employees as a district, as a municipality. So I think that's another thing you can comment on. Also, the tax benefits in places that are that pay a lot of local taxes. You can refer to that aspect also. But then I would go back to your original statement about, personal stories. And I think if someone is saying, we shouldn't have to pay for them, things like that, that just, you can't argue with statements like that. Those are just their values that are different from our values. Sometimes going back to personal stories can be a good approach, and being vulnerable and trying to speak human to human and put aside the politics can be another approach.
If I could just add, I've
Thank you so
re-registered,
much. Thank you.
but to that point, I've re-registered multiple people with Trump flags in their yard by just telling my personal story. Like, I have gotten Trump Republicans to become Democrats because of my personal story. So it can happen.
Me too. Yeah. Yeah.
Thank you. Thank
You're
you.
braver than I.
Really. Jean, and then Helen, and then Earl. Jean?
Yeah, I would say if somebody starts calling it socialist or communist, you could say something like that. Well, then it's socialist in the same way that Social Security and Medicare and the way we pay for the fire department is socialism. So you can kind of bat that down. And as far as I think actually almost everybody except very wealthy people are underinsured. It kind of depends on what kind of medical luck you have and what happens to you. And you can say to people who, if something really serious and expensive happens to you or somebody that you love very much, and your children, your parents, you could wind up losing everything you've ever saved in your life. So they could be you.
Right. Thank you,
Thank
Jean.
you.
If I may, the other one I always bring up is every other rich capitalist democracy in the world has this. So my comparison is German. So Germany is communist, huh? What about Japan? What about the Republic of Korea? What about South Korea Republic? So, yeah, so point made. In other words, my comparator isn't Cuba. My comparator is Germany, France, Australia, New Zealand, et cetera, et cetera, et cetera.
You got it. Thank you, Steve.
Thank you.
Earl next, and then Helen.
Yeah, hi. So the other thing, Betty, first of all, thank you. That was really concise and super good. I know that will work in the street. And the other thing I would just add is mentioning pre-approvals and denials. That really clicks with people. Why do you want to be paying more to be able to have an insurance agent get mixed up between you and your doctor? Shouldn't the decisions be between you and your doctor and not an insurance agent who's motivated by profit? And then not to mention the denials, which are affect people's lives. People die, so I think, and a lot of people have experienced that. So it works good in the street.
Good. Thanks,
Yeah,
Earl.
that's a great point. And I when I'm talking to doctors, I usually mention the support of physician societies that the American Academy of Family Practice, the American Academy of Pediatrics, support the National American College of Physicians. But then I also always mention, I'm just thinking about in addition to prior authorization, which doctors hate, how long our notes are, that we have to spend all of our time writing these long notes that are all about billing. So the administrative burden that physicians would save is another big one. But yeah, that's helpful to hear what works for you on the street.
Just to follow up, I mean, you're a doctor, so I would think that it must be heartbreaking for doctors to have to break the news to their patient, like, oh yeah, we came up with a treatment, but you got to figure out some way to get some scratch for that because the insurance company is not willing to pay.
Yeah, and I think
Heartbreaking.
it's yet another way that it pits people against each other, because when an insurance company denies something, that means that we get a stack of forms that we're supposed to fill out. And so it's like, ugh, now I have to, there goes my lunch hour. Now I have to spend my time trying to get this care for this patient. And it's hard not to feel, annoyed and angry that you have to do that in the first place. So now ideally not holding it against your patient, but that's really, driving patients and doctors apart from each other rather than uniting them in the common cause.
Wow.
All right, let's take two more and then we'll see if we can break out. Helen and then Mary.
In terms of the accusation, isn't that socialism or communism? Actually, it really isn't, because the hospitals and the doctors are private. It's privately owned. It has nothing to do with the state taking over our medical care. They are not doing any of that. They're paying the bills, but the actual care and the administration and the ownership is private in doctors and hospitals' hands.
Good, thank you for that. Mary, and that'll be the last question before we break out.
Yeah, nobody's brought up at this meeting yet, but that always tickles me, and that is getting back to the idea of pitching at different levels of government. I don't know about other counties like downstate, but up here, Medicaid is like about 60% or more of our county budget. So we like to call it the New York Health and Property Tax Reduction Act.
Right on.
I don't know why they're not falling over, giving it support.
All right, good point. All right, let's use this as a moment to shift. Betty, thank you again very much for sharing the really good, concise presentation with us. So,
for having me. Great to meet you all.
Very well. Drive safe. Or feel free to stay on if you're up to it, but we'll move ahead. We have about a half hour left in the hour that we've allocated for this. For us to small groups, maybe 3 people each or so, for us to try out with one another. Just what is it that we would say when we said, when you ask somebody if you've heard about the Health Act and they say no, what can you glean from tonight's presentation, and perhaps embellish it with your own ideas about how you would speak to someone about this. So Ting, let me ask.
I thought Julie was going to intro how we do this.
Oh,
Are you still up for that, Julie?
Right,
Yes.
Julie. Yeah, go ahead.
Thank you, everybody. Yeah, so basically, Donald, you said it, but what we're going to do is break out into small groups with a facilitator in each group to practice our talking points. It's not that we have to be Betty, it's that we want to be ourselves, presenting the points about the New York Health Act any way that works for us so that we're prepared for anything, for tabling, house parties, impromptu encounters on the street. So we're going to break out into these groups so that we have an opportunity to actually practice what we would say. And, interestingly, we kind of know a lot about the New York Health Act. Most of us have been organizing for years, but when you actually think about how you're going to present it, sometimes it's not, exactly something that you put together. So, we're kind of encouraging people to figure out how to put it together. And we're going to practice doing that with each other. So we will be assigned by Ting into some great facilitators. And I just want to say, if anybody feels shy about public speaking, still go to the breakout room and listen to other people, support other people. And, maybe you'll get the nerve to do it today, and maybe you'll learn something and be able to do it at a time. But hope you'll stay and you won't feel forced to speak. But it's a really good experience to try that out with a friendly group of people, which is what we're about to turn into, a smaller friendly group of people. So thanks.
Okay. With 4 minutes to spare, I hope your individual group work was productive for you, and you now know a little bit more comfortable about what to say when somebody says, "What in the world is the New York Health Act, and why should I care?" Anybody have a last minute comment before we sign off?
I just wanted to ask if there were any other Bronx people besides myself and Helen. I guess not. Okay.
Okay. Ting, anything else we need to cover before we close?
I don't think, I just wanted to ask though, I enjoyed ours, was very wide ranging, and I was wondering whether anybody had any thoughts about what, if they actually had any understandings about something that they hadn't had before. And maybe not, but. Steve? You're muted, Steve.
Sorry. This wasn't in response to that, but it's I think a way in that's important, that's only recently started to circulate, is something to use, which is we often run the situation of nobody's heard of the New York Health Act. And one of the points I make sometimes, like, especially in the context of like an elected saying, well, my constituents aren't saying anything about the New York Health Act, is that's the wrong way to approach it. No constituent, no average person is talking about specific state legislation by name. But almost everybody complains about their health insurance company,
Right.
especially if they've ever had to use it. And so my approach is not to talk about the New York Health Act. It's, unless you really love your health insurance company, here's something better or something to that effect. But approach it by the, dealing with health coverage, not by legislation name.
That's a great input, Steve. Thank you. It's what we use when we go canvassing, asking people to sign petitions or get out the vote. What are your issues? My candidate's position on those issues is really important for you to know. That's another way to get to it. So I see Mary's hand up and Julie's.
Yeah, I just wanted to take a little, well, I don't know, exception. I happened to run into my state senator in the hallway at Albany once, and that's just what he said. Oh, I'm not hearing from anybody about the New York Health Act. And my response to him was, well, then your assistants are not passing the word along to you, because we're always having our group members, I don't know how many of them do, but I do, call and ask them to support the New York Health Act. But yeah, we need more of our group members to do that. Get on the phone.
Yeah. Or you could say, are you hearing from any of your constituents about their horrible healthcare and health insurance problems and going bankruptcy?
He's not hearing it, but he needs to.
Yes, I would say they're not hearing about the New York Health Act, but they're hearing about healthcare horror stories.
Well, that's all related.
Right, and that's a really good point. Julie, you had another comment? You're muted.
Yes, I was just going to say that for follow-up, if anybody is interested in more of practicing how you would be talking to other people about the New York Health Act, let us know, because we can set up some small groups and have some conversations and get people comfortable in how to speak about this.
Okay, good. Thank you. And just off that, I mentioned to Denise during our session that we've written 2 letters that might be useful. One is from the volunteer yourselves to your provider to say, this is what the Health Act is all about. You might be interested in, the last 2 minutes of your encounter, talk about the Health Act for a minute and a half. And if they're enthusiastic, hand them that letter from you, the volunteer, to the provider. And if the provider is interested and enthusiastic, hand them the second letter that is from the provider to the provider, to their colleagues, to say, hey, I just met with somebody from the New York Health Act, and they can do a lot of good things. You might be interested, and let's get this act passed. We can probably make the letters available, Ting, with the minutes.
Yep, will do.
Okay, so we'll do that. And if you have any questions, you can let me know, and I can follow up. All right, it's 9:01. Any other comments before we close?
Yes, I'd just like to say that it was really genius to set this out as, you know, a quick way to make a quick impact when you talk about the New York Health Act, and then to have us go into our small groups. That was so helpful. It just makes me think, you know, you could just invite your friends to say, hey, let's want to have a quick Zoom about the New York Health Act or about your problems with your health insurance. And I think that the small group thing, it could be really powerful. We could really just, I think, use this format. So thank you.
That's great. We
You
call
know,
that,
I just want to say, it would be useful to me, I think, to observe somebody else, you know, rather than giving me information, which is useful, that's certainly good. But I'd also like to see somebody else sell it, you know. That would be useful to me.
yeah. So how do we do that? We make people available. Well, let me
I mean, you know, like, you know, a simulation or something where somebody
Yeah.
actually goes through the process.
Mimi, are you familiar with the Campaign for New York Health, which is another coalition of folks who are focused on?
From time to time, I've gone on different, you know, different things. So I may have participated in something once before. But
What they're doing is now they're putting together a statewide education team that's going to learn the presentation, not Betty's, but a very longer one, more comprehensive for a longer session, and present that presentation to various groups, faith-based groups or community centers or American Foreign Legion.
okay.
So stay tuned. If you're on the Campaign for New York Health email list, you'll be hearing about that.
Okay. Campaign for New York Health. Okay.
Yeah.
Me, if you want to practice with me, I'd be delighted.
Okay. Thanks, Helen.
Great.
I'm
Okay,
just,
with that- Oh yeah, go ahead.
just to echo what Gina said, I thought this was fantastic and well set up and really helpful. So thank you all.
Great. Thank you,
Thanks for
Tom.
coming.
Yeah, thanks. Thank you all for coming. We'll see you next time. Good
Okay,
luck.
thank you.
Get out there and spread the word.
Oh, just
Oh,
really quick,